everybody, my name's Joss. I've been asked by Miss Hardiman just to make a little video for you just to talk a little bit about what it is that I do. She's given me a nice little list of questions, so if you see me looking down it's because I'm reading off here. So I am a student paramedic, which means that I'm currently training to be a paramedic, and I go on placements with the ambulance service, so I do lots of time on the ambulances so I can, learn what it is I need to do. So the first question is, what special or unique things do you do in your job? Well, my job in itself is really, really unique because we deal with emergency situations. So if somebody's really, really poorly, or if somebody has had an accident and they've really, really injured themselves. But what's unique about my job is we do it in lots of different places. So you'll go to jobs that are maybe in the woods or on a beach. I've been to lots of calls in supermarkets as well where people have taken ill. We deal with lots of things such as car accidents, and we work together with the police and the fire service as well. We work with midwives when people are having babies. We go to lots of older people that have fallen in their homes or out in the streets as well. So every day is completely different, which I think is something that makes this job really, really unique to other ones. Number 2, do you have to wear a uniform, and if so, why? Well, I'm sure you can see on the ambulances we have this very, very nice green uniform. There's lots and lots of reasons why you need to wear a uniform. The main one is so when we turn up to emergencies and people see us wearing our green, they know that help is there now. So it's quite easy to identify a paramedic or somebody that works on an ambulance from the uniform. But because we all wear the same one, we all need to wear different epaulets to just say what our job title is, because there's lots of different jobs on the ambulance. So mine says UEA student paramedic. Another reason we have to wear a uniform is because we go to lots of different places. Sometimes we can get really, really dirty. So we don't want to be getting that all on our own clothes. So it's good to have a uniform, and we always take a spare uniform as well, just in case we do get very dirty. Number 3, do you use any special equipment? We have got so many different bits of equipment on the ambulance and on ourselves as well. So one of the really, really important ones that we use, this is, I'm sure you've seen before, a stethoscope. And we use this to listen to people's hearts and listen to people's lungs, because that can tell us whether there's a problem or if there's maybe an infection. And if there is an infection, we can give lots of different medicines to help people to breathe. So that's really, really important. Another one that I've got at home, this is slightly different to the one on the ambulance. This is called a pulse oximeter. And this is the one that we put on the end of your finger. And it tells us how much oxygen is in your blood, and it also tells us how fast your heart is beating. I can imagine if I do mine now, my heart is going to be beating quite fast because I'm a bit nervous making this video. So should we have a look? It takes a little minute for it to kick in. But this is a really, really handy piece of equipment, and we use this one a lot. Just give it a second. Oh, there we are. So my oxygen level is 100%, so that's really, really good. This one is not very good. It's flashing at me because, like I expected, my heart is beating very, very fast at 122 beats a minute. So we're going to take that one off now. Number 4, why do you enjoy your job? There are lots and lots of reasons I enjoy my job. I think the main one is because we get to help people. We see people in emergency situations when they are really, really frightened, and it's nice to know that we can make a difference and make things a little bit better for them. And it's nice when we can give people some special medicines, or we can do other medical interventions, and we can actually see them getting better before our eyes as well, which is really, really nice. And I've already said it's different every day, and I really, really like that. So some days I might go to somebody that's having trouble with their breathing, I might go to a car accident and help get somebody out of a car and assess them and give them medicine and get them to hospital. On my last placement, I got to help a lady have a baby, and that was amazing. I think that was probably my favourite job that I've been to so far. That was a nice, happy one. They're normally quite sad jobs, so when we get a nice, happy one like that, it's really, really good. I've got to fly on the air ambulance before, which is a really special ambulance. It's much, much faster than a road ambulance, and it's got specialist paramedics and doctors on board, so they deal with the really, really poorly patients. So that was a really exciting day for me as well. And number 5, how did you become a paramedic? Well, I'm not quite a paramedic yet, but I'm getting there. I'm in my 2nd year now, and it takes 3 years at university to become a paramedic. It's a really, really brilliant job. I love it, and hopefully some of you, maybe after listening to this video, might think that you want to do that when you're older as well, and definitely go for it. It's a really good job. So that's my questions done. But before I go, I just wanted a little side note. I'm sure you're doing it already, but make sure that you keep washing your hands to keep yourselves and everybody else nice and safe through this pandemic. And if you can't get to a sink, make sure you've got lots and lots of hand sanitizer. Right, bye.